there's a bunch of things that plays out. First of all, the close proximity of prisoners and not being able to social distance. Remember, we are still readmitting prisoners who goes for their trial right up to the 27th. We were still readmitting them. There were people who would go in front of a judge to find out if they can get bail and those kinds of things. There are people who may have appealed their cases, and after being in the prison for an entire year or so, they finally have to go to hear why they should be granted bail, those kinds of things. Even if it is for trial, they have to come back. And remember, when they leave from here, they're in the custody and care of the police. Then when they go to the court, God knows what they do and who they associate with and those kinds of things. We cannot really isolate them for 14 days because there are times when they have to go right back to court again, maybe in the next week or within the next couple of days or the following day. So there's a possibility that they may have been the ones that brought it back in. And when they went to their respective building, they infected the other guys. And remember how COVID works. It spreads. The Ministry of Health has certainly gotten more closer to the prison, especially since the 27th, when this 90 positive cases turned up. They are helping us in just about every way possible to mitigate the spread. And when I say help us, aside from testing, we're talking about things like medication, vitamins, sanitizers, protective personnel, equipment, those kinds of things, in every way possible. We've had other measures in place all along. I think this time around, it is this solid 24 hours a day, 7 days a week quarantining that should make all the difference. And we shall be retesting after that time has passed, and we will see the results. I am telling you that as of today, we have 19 recovered cases. So the quarantining does work. I have no doubt about that in my mind. One of the things after analyzing the situation, it would look like we would literally need to have a full-time health officer at the prison, probably conducting rapid tests on maybe incoming staff who are beginning their shifts and inmates who are being discharged, just to make sure that they're not taking this virus out with them. That is pretty much one of my suggestions, and I do plan to communicate with Dr. Manzanero and see if that is a possibility.